Medicare and all that. We could do the same with voter registration. And again, I would just encourage people to look at the candidates. There's some discretion in how people carry out the duties of the office. Look at the candidates and vote accordingly. But people can call us if they have questions about how to get out and vote. Hi.
The cost of health care for the last 2 quarters has remained stationary at 0.5%, according to Dean Baker, an economist with the Institute for Policy Studies. He says that this is in contrast to the previous year and past years of an 11% annual increase in healthcare costs. And if it remains low like that, and the Bush tax cuts for the wealthy are not continued, that by 2020, a budget surplus will be predicted. Can you comment on this data?
Well, I like Dean Baker, and I like to try to keep up with his stuff when I get the chance. I think he's a very good economist. I'm not familiar with this particular study that he said, but one of the things that happened recently as a result of health reform, and I don't know if this is one of the things that helped control costs, but part of health reform was requiring that insurance companies keep their medical loss ratio at 80 to 85%. Medical loss is when they have to pay out for you going and using health care services, because that's considered a loss. We consider it their job, but they consider it a loss. So now they have to use 80 to 85% of premium dollars to pay out for medical services, and I don't know if that has helped contain some of the costs a little bit. I'm waiting to see healthcare consumers renewal, and we'll see what percentage our costs are going up. So.
We keep hearing all these news stories about how, because of healthcare reform, premium costs are going to skyrocket, all these employers are going to dump their employee plans, and the rest of us are all going to get price gouged with excessively high premiums. Do you foresee that happening, or is that more scare tactics like the death panels?
I don't really understand that. I think it's a scare tactic. I think remember that healthcare costs, I think, will probably continue to go up still. The rate at which they will increase and at what point they level out, if they level out, is a different question. But I don't think they're going to skyrocket. We saw our health insurance premiums skyrocket, 3 or 4 years ago, when they went up, within less than 4 years they had gone up over 100%. And actually even more if you factor in that gender discrimination that I had talked about. I think that actually with some of the cost control mechanisms that are part of health reform and some of the tighter regulation and more people getting insured, the pools will be growing and more people will be getting insured. I would think that those are some of the cost control mechanisms. But you know what? I'm willing to take that chance. I'm willing to take a chance on health reform and see how it goes and have a law that we can work with and try to change when necessary or tweak the regulations and have greater oversight and transparency and accountability to the regulations and to the health plans than what we had prior to health reform. But I think that that's probably a scare tactic. Other questions? Yes.
Yes, first of all, I want to thank you for all your great work and leadership with your organization. My question really relates more locally to Champaign County, and I would like to, I would include in the leadership the work that you've been doing in trying to help Francis Nelson Health Center move forward, and with new leadership and with a local board. How does health reform, how does this, with the assumption that the Obama administration is reelected, what type of federal help will we get, and what can we do as concerned residents of Champaign County to try to get Francis Nelson back on their feet?
Let's see. Well, as part of that process, there are some things that I can and cannot talk about because there's a transition going on. But in terms of health reform and federally qualified community health centers, if health reform stands, and remember, if it stands, it's not just based on the presidential election. There's people running for Congress. Congress can undo it, right? So all of those levels of government are really important. But if it stands, community health centers stand to get a lot more funding. There's a lot of emphasis on, when you insure more people, that's going to be their ticket to health care. Where are they going to go and get that health care? And community health centers are really an important part of the infrastructure for providing accessible primary care, family care, and things like that. So I think we will see a lot of grant funding that Francis Nelson and other types of services like that will be eligible for. So I'm optimistic. I think it actually spells a new future for community health centers, federally qualified health centers. In terms of what people can do, I think one of the most important things is that, and thank you for your comments, by the way, but I think one of the most important things is that people need to get connected to organizations. If you want to keep up with what's happening with the changes in healthcare policy or the health reform law being implemented, or if the worst case scenario takes place, people need to get connected to organizations and to movements, figure out who you trust, get on their email list, attend meetings, or just subscribe and keep up. And then when there are opportunities for action and support, for example, there may be something that happens, down the road for Francis Nelson where we need a lot of community support, whether it's in the form of contributions or hands on deck to do something, then people can know about it and they can get involved. Nonprofit organizations like ours do a lot to try to help get the word out, but we're a small organization. All of our staff just about are right here, and Paulette, Chrissy, and Jen. And we're a small organization and we don't have a lot of advertising dollars, so we sort of rely on people getting connected with us, getting on our listserv, Facebook, on our mailing list, coming to events and things like that. And I would say do that for the organization